Our next section on the final exam review will be covering Chapter 11, Diet and Health. I like to start with to differentiate between correlation and causation. Remember that correlation is an association. So it basically means that there's an association between a risk factor and a disease. It doesn't mean that the risk factor actually caused the disease. Causation is actually the production of an effect. So an act or an agent which results in that effect. Very important that you understand that correlation does not equal causation. And just to demonstrate this point, let's just take a look at some data. And this data for cable systems is from Time Warner. And looking at 1980 to 2000, you can see there's actually an increase in the cable systems purchased and installed in the home. Now, if we look at the death rate from heart disease, and we can see from 1980 to 2000, it actually decreases. Now, we can't say that installing cable in your home will prevent your risk of heart disease, or you're going to have a less risk of dying from heart disease because you installed a cable in your house. No. So there's something that is correlated between these two, but we can't say one caused another. And so that's an important take-home point, is always to think that when two things are associated, they're not necessarily causing one another. All right, so this is the prevalence of diabetes, another just example. And if we looked at Apple computer sales, so could we say that buying an Apple computer caused diabetes? No, there's an association here, and I'm sure if we looked into it, we could find the correlation between these two, but one does not cause another. So heart disease. Heart disease is essentially caused by atherosclerosis. So this is a thickening and plaque formation of an artery. Now, even though it's characterized by plaques, and we think of it as the buildup of these plaques in the arteries, it's actually a very complex inflammatory process. I do not want you to finish this class thinking that fat clogs arteries and causes heart attacks, because that is not the case. Okay? This plaque that builds up doesn't just continue to narrow the arteries, close them off, and someone has a heart attack. It's actually a very complex inflammatory process. Low-grade inflammation is very much a part of this process. Clotting is a part of this process. Lipids have some role in this, but it's more of the oxidation of those lipids. And when that clot breaks off and ends up kind of going downstream in the artery, and then it ends up blocking the passage of the blood flow. But very important, you definitely need to know that this is a complex inflammatory process, and it is not cholesterol or fat clogging the arteries and causing basically a heart attack or a myocardial infarction. So what are the risk factors? Well, the ones we cannot change, the non-modifiable risk factors, are increasing age. The male gender, so men have a greater risk of heart disease than women, and family history. I have George Burns here because he seemed to eat whatever he wanted, not exercise, and smoke cigars, and live to be over 100. So you can't really swim out of your gene pool, but and you can't change these factors, but there are a lot of things you can change. And remember, it's always a combination of genetics and lifestyle factors. So what you do, what you put into your body, how active you are, in combination with your genetics. And it's those two things that contribute to chronic disease risk. With heart disease, we look at the modifiable risk factors. And the first is going to be an increasing weight. Essentially, obesity is going to increase the risk. Tobacco, definitely going to be one of the top risks. Blood pressure, so an increase in blood pressure or hypertension is definitely going to increase the risk. The increase in abnormal blood lipids, so that's going to be usually a high LDL and a low HDL, but remember that it's particularly the small dense LDL that is going to increase heart disease risk than the larger buoyant LDL. We call that the high LDL and low HDL dyslipidemia. Insulin resistance. Remember, we talked a lot about this in chapter 4. So their bodies lack a response to insulin. The cells not recognizing it because there's been too much insulin because of the high blood glucose. So this is a pre-diabetic syndrome. Insulin resistance and or diabetes do increase the risk of heart disease. And of course, sedentary behavior. Now, what's the one thing that wasn't on there? Diet. So this is the big one, of course, that we're going to be focusing on. An atherogenic diet. So that is a diet. So athero, like atherosclerosis, meaning plaque forming in the body. This type of diet is going to contribute to plaque formation. It's going to contribute to inflammation. So a diet high in processed fats, processed saturated fats and trans fats. High in cholesterol, high in refined grains, low in fruits and vegetables. So this is going to be your atherogenic diet. It's essentially the exact opposite of the diet that we've been talking about this semester. Okay, high blood pressure. This is one of the risk factors for heart disease. High blood pressure essentially means that the pressure within the bloodstream is too high. So what are these things that impact blood pressure? We know that how much the heart is pumping the blood, that's going to increase the pressure. The size of the arteries. The smaller the arteries get as they go down from the big arteries to the capillaries, as they decrease in size, the pressure will increase. And then the volume that's going to be in the vessels. The volume is largely controlled by the kidneys, so the kidneys definitely have a substantial role in how much fluid and volume is in the vessels and in the blood pressure within the vessels. Also, the flexibility, the hardening of those arteries. If the arteries are more calcified, if they're harder, then that means they're going to be less flexible. So if you think about an artery that when, like a balloon, and if you fill it up with fluid and it can expand, you're not going to have as much pressure. But if it can't expand and you're still trying to pump fluid in, there's going to be more pressure. So a firmer, harder, more calcified artery is going to increase pressure more. So again, if we have more narrowed vessels, there's definitely going to be an increase in pressure. Narrowing of a vessel, if we think the plaque around that vessel, definitely is going to decrease the size of the blood flow within that vessel. A normal pressure, generally less than 120/80. 115/75, I would say, would be a little bit of a healthier blood pressure, and you can even have lower pressures than that are still considered healthy, particularly for athletes. A high blood pressure is 140/90. The risk factors, atherosclerosis. So I want you to note that hypertension is a risk factor for heart disease, and heart disease or atherosclerosis is a risk factor for hypertension. So again, it's going to create kind of a vicious cycle. Obesity, insulin resistance, age, genetics, race, sedentary behavior, diet, excess alcohol, and stress. So look at how many of these overlap with what we had talked about for heart disease. So how do you lower blood pressure? Well, definitely lower sodium intake, but I want to point out that this is definitely associated more with a decrease in processed foods and is actually not as important as some of the other factors. So losing weight, moderate alcohol intake, but increase in fresh, whole fruits and vegetables. Nothing we haven't been talking about all semester. So this is actually as important as the sodium. Now remember, if you go back to chapter 8 and you think about fluid balance and cell integrity and how the maintenance of the electrolytes maintain that fluid balance within the cells and within the bloodstream, you need an equal balance of sodium and potassium. So if you're taking in too many processed foods, pretty much anything in a box that's going to have sodium, and a low intake of whole, fresh fruits and vegetables, going to have way too much sodium and too little potassium. So a balance. So this is what most people are doing. Reduce intake of fat, specifically any sort of processed fats, trans fats. Increase in calcium, potassium, and magnesium. These three nutrients, these three minerals in particular, will help with fluid balance. And maintenance of blood pressure, and then increasing physical activity. So that pretty much represents the DASH diet. So the dietary approach to stop hypertension is actually more effective than just trying to cut salt. Just decreasing that salt shaker, that's not going to really do it. So really increasing the intake of whole foods, that's going to increase the intake of calcium, potassium, magnesium, and vitamin C. You don't need to eat dairy to get enough calcium. Remember, if you're eating enough fresh, whole fruits and vegetables, particularly an intake of your leafy greens, you can also get it from broccoli, intake of nuts such as almonds, you're going to get enough calcium. On to cancer. So I want to look at some of the causes of cancer. And of course, we all think about it heavily relying on genetics, but genetics is just one factor. Viral infections, this isn't really something we can control for the most part, but so we have two of these kind of non-modifiable risk factors. Lifestyle choices, very big factor in this. And with all of our chronic diseases, it's a combination of your lifestyle choices and genetics. Environmental factors, so think about things in your environments. If you live in a heavily polluted city such as Beijing, you're going to have much more exposure to environmental pollutants. But even things such as all the plastics and all the food containers we use can have chemicals that can contribute to cancer. And of course, nutrition. Sometimes I'll lump lifestyle and nutrition into one. So lifestyle factors, this is going to be alcohol intake, tobacco intake, and the amount of exercise you get. So if you eat a lot of processed food, you smoke cigarettes, drink alcohol in excess, and don't exercise, your risk of cancer is going to substantially increase regardless of your genetics. If you have cancer that runs in your family, you're really upping your risk for developing cancer later in life and maybe not so later in life. If you don't have a risk of your family history of cancer, you don't smoke, you drink alcohol in moderation, you exercise daily, and you eat a diet of whole food, lots of whole food, fresh fruits and vegetables, plant food, your risk is substantially going to go down, particularly if you live in an area, say, like Humboldt County that has clean air. Your risk is definitely going to go down. So even if you have a family history of cancer, there are a lot of steps you can take to control your risk of developing cancer. So knowing your family history is very important. Now, when I talk about environmental exposure, this is to what we call carcinogens. Carcinogens cause damage to our cells, so cellular damage, and that kind of leads along this line, this domino effect that results in cancer development. Now, of course, tobacco is probably one of our most well-known carcinogens. There were some others in the past, such as chemical pesticides, such as DDT, that was popular more than 50 years ago, thank God. And what that does is it causes damage to our DNA and also to other, it can cause damage, cellular damage as well, but even on a smaller level, damage to the DNA. So when these cells do multiply, that damage that has happened, that essentially a mutation that happens, ends up multiplying. Then there are promoters. So this is where other environmental factors, your diet comes into play, and I have a bunch of junk food here, but a lot of the, chemicals that can be in foods, or actually the foods that you're consuming, can actually promote or not promote cancer development. So if you have a promoter, then that's going to cause more cell replication with the mutation within it. And then that's when you think of that tumor actually developing. But where it really becomes deadly is when it metastasizes. So metastasis is when it invades into the bloodstream and starts spreading. So you hear of someone of a breast cancer that ended up getting into their bones. And for the individuals I've known with this, having a stage 4 cancer, is they may not even know that they have breast cancer until they end up breaking a hip at 45, something that someone who is 85 only should do, after tripping over maybe a lamp cord. And so that is basically the cancer, those abnormal cells getting into the bone. Now, if you have basically a cell that should be a cell makeup of a breast tissue, and that gets into a bone, it's not going to act like a bone tissue. It's not going to, give that strength that the bone needs. So anything that's going to invade in there is going to make it weak and put it at risk of fracture. So this is the steps of cancer development on a very, 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 very basic level. But that's all you have to know for the final. And something that's important to think of is that even if you eat well, even if you live in a non-polluted city, you don't smoke, maybe you don't even drink, exercising every day, you're still exposed to carcinogens daily. And part of it is we don't even know all of the carcinogens that are out there. We talked about the 10,000 or more chemicals that are in our foods due to pesticides and packaging contaminants and food additives, and we haven't really identified all of those which can potentially contribute to the development of cancer or would be a carcinogen. In addition, you have something like 100,000 chemicals that are approved for use in products, and that could be everything from cleaning agents to things in your shampoo, and we don't know which ones are really going to contribute yet to cancer development, and it might depend on your genetics. So there are a couple things that are important. One is to decrease the exposure to as many as we can, especially the ones we know that do cause cancer, but also to know that your body has a nice system that, even though we're exposed to these, not all of those carcinogens actually end up causing damage. So that's one good thing. The next thing is that the antioxidants that are naturally occurring in our body, the ones that we get from consuming fresh whole fruits and vegetables, they're going to quench those free radicals. Remember, quenching that free radical prevents that free radical, which is really unstable to binding to cell membranes and to proteins and to DNA. So it prevents it from causing the damage, so it doesn't even start the process. But if that process does start, the body knows how to repair that damage. So the body can go through and say, oh, you know what, this is damage here, let me repair it before essentially that cell is going to multiply. So we don't have that mutation actually multiplied, and we can prevent it before it starts. If the damage is not repaired, then the cell has this almost self-destruct mode. If it ends up multiplying, sees there's a lot of damage, the cell can self-destruct. So it's only when all of these end up happening and you get to the point where the cell doesn't self-destruct that we end up going down the line of having cancer development. All right, so how do you reduce your risk? Fresh, whole fruits and vegetables. I don't know how many times I've said this enough throughout the course. This is going to decrease your cancer risk no matter what your genetics are. Whole grains. Remember, processed food that has whole grain listed is not a whole grain. I mean whole grain. It looks close to what it looked like in nature. So Cheerios, Special K cereal, Raisin Bran, those are not whole grains. I'm talking about things like wild rice or quinoa. Low in calories, so not overindulging in calories, maintaining a healthy weight, and getting enough exercise. Low in saturated fat, there's still some mixed research on this. Saturated fat has been thought to be a promoter of cancer, and it probably is in certain types of cancer in some people. Limit red meats. If you have a high risk of cancer, meaning you have a genetic predisposition or cancer runs in your family, or you've had a diagnosis of cancer, then you should probably limit red meats. This is all red meats, and particularly red meats cooked at high temperature that are barbecued or any sort of deep frying. All of those things are going to increase the risk of cancer. Definitely limit processed meats. We've talked about that all semester. Limiting alcohol intake. Even one drink a day for a woman is going to increase breast cancer risk. Generally, above and beyond that. So when you get into 2 and 3 drinks for men or women, it's going to increase the chance of mouth, larynx, pharynx, esophageal, stomach, and liver cancer. And of course, avoiding tobacco. I want you to think about food and how it impacts cellular function on a very, very small level, and even impacts genetic function. So what you put into your body actually has the ability to turn the genes on and off, increase or decrease your risk of cancer, despite your family history or your genetic predisposition to cancer. So more processed food going to increase your risk. Whole food will decrease your risk. So think about that working on a very small level and know that it's a combination of your lifestyle factors, your nutrition, your diet, and your genetics. And this is the end of our section on Chapter 11.